want to say good morning to all of you that are joining us across the World Wide Web as well. Good morning to each of you. And those of you who would like to watch the program live, you can go to youtube.com. Now, let me make it easier. Go to my website, which is askdrferguson.com. When you get to my website, at the middle of the page, you'll see Live Radio. Click on that. That'll take you to the YouTube site, at which time there's a little house in the top left-hand corner. Click on the house, and then click on Feed. And you'll be able to watch the program live. If you choose to do that, you probably want to cut your radio off because there's about a 30-second delay with the internet transmission. But for those of you who want to watch it live on the radio, on YouTube, you can join us there. Those of you who joining us live on the radio, we welcome each of those different audiences. And we're always happy to be back with you guys each week here. And don't forget to tell your friends to tune in on Wednesday, 9:30 to 10. We'll do the live radio program, something on preventive health. And it could vary a lot on what we end up talking about that day.
Okay.
Sometimes it might be a current topic, but sometimes it might be something in preventive health category. But tell your friends, join us both live on the YouTube as well as on the radio. We come live. I'm broadcasting from the Down East Nursing Home where I'm seeing patients. I break from seeing patients, and we're tapping into the radio station in a Husky 970.
All right. Well, there's so much to talk about, and Ebola seems to be the top of the list today. Every time you turn the TV on, there's something about that.
Well, and that's something that a lot of people probably don't know a lot about. So we can start off by talking a little about the Ebola virus. Viruses are small, very tiny, microscopic things, and you have bacteria, you have viruses. Those are like the big two. When you talk about a cold, when you talk about things like that, a cold is 90% of the time a cold is going to actually come from a virus, but most of the times people think it's a bacteria, and they say, Doc, I need an antibiotic. Well, you don't treat a virus with antibiotics. If you treat a virus at all, you treat it with an antiviral agent. So there's lots of different types of viruses. Many, everybody remembers the flu that went around this past couple of years. What was it, N1H1 or H1N1?
Something like that.
Something like that, but a lot of people remember that because we had children as well as adults getting sick, and even some people dying from that. So, but that was a virus, and there's many different types of viruses, and they function differently. Some are more deadly than others, and some can be very dangerous and very contagious, and others are less contagious, like the HIV virus. Everybody's heard of AIDS, the HIV virus. Right now, in this day and time, the HIV virus is under very good control, and people are living almost completely normal lives with the proper medication and proper treatment. But again, that's a virus. The herpes virus, people heard of the herpes virus. You can get it through sexual intercourse. You can get it through herpes gladiatorium, say like you're a wrestler and somebody's got a herpes lesion around their mouth, and their mouth is coming in contact with your arm or your leg. You could get what we call herpes gladiatorium. So you have different types of herpes virus, and the two big ones, one would be sexual transmitted, and one would be the one you find on the like around the mouth or something like that. Another virus people hear about is shingles. That's another virus. Okay, that's the same virus that causes chickenpox. So you can see there's lots of different viruses that most people have heard of some of those viruses as they've gone through life. But the Ebola virus, that's a different virus. And the Ebola virus is one that we've not had a lot of exposure to here in the United States. The Ebola virus is a virus that causes a viral hemorrhagic fever disease. So hemorrhagic means bleeding, fever means temperature. And it can cause fever, headache, joint pain, muscle aches, weakness, diarrhea, vomiting, stomach pain, loss of appetite, and abnormal bleeding. That's one of its characteristics, that abnormal bleeding. The symptoms usually appear somewhere between 2 and 21 days after exposure to the Ebola virus, and that exposure is usually common like 8 to 10 days in the most times. It's a setting of, you contacted about the virus between 8 to 10 days, you start showing symptoms somewhere between 2 and 21 days. And so Everybody wants to know, well, how do you get the virus?
Yeah.
Well, the virus is transmitted through direct contact, either with someone's blood or with their body fluids. But it has to be from a patient that's infected with symptoms. The symptoms parts is pretty important. You could get it by being exposed by needle, or you had some of the contaminated secretions. Might have gotten on your, through sexual intercourse or something like that. But right now, the word symptoms is an important word. The symptomatic person is who's going to transmit the virus. Before they're symptomatic, the virus is usually not going to be transmitted. It says, can the Ebola virus be transmitted via air? No, it doesn't go via air. It doesn't go as a respiratory disease like the flu that many of you hear about. You get your flu shot each year to try to prevent that from happening. But this is not transmitted that way. Is it transmitted through food and water? Nope, it's not transmitted through food and water. It's not a food-borne illness. It's not a waterborne illness.
Got to have direct contact.
You need direct contact. So a person that has the Ebola virus who's infected but does not have symptoms, you won't get it from them either. Okay, so if they're infected but don't have symptoms, you also won't get it from them. It takes having an individual with symptoms to be contagious. And in order the virus to be transmitted, you need direct contact between that person that has the disease and somebody that doesn't have the disease, and it's transmitted through blood or bodily fluids. So no, at present, other than the two that we shipped in here from West Africa, we don't have any cases of Ebola virus in the United States. So you can be pretty confident, unless you're interacting very intimately with someone that came from West Africa, not just Africa in general, but West Africa. The chance of you coming down with the Ebola virus is pretty slim. Actually, probably about close to none. But that that is that's where we know it's coming from. We know it's coming from the Western Africa area. And so what they're doing now is they're trying to do some prevention. So in the West African country, they are trying to do some education amongst the general population. They're trying to educate them at the airports, like in Libya and Syria, Ghana. They're trying to educate them at those airports about the Ebola virus, the symptoms to look out for, and the response, the healthcare questionnaire, that they're trying to help people out that way. They've put out a lot of people to help build the capacity on the ground to help people understand what they're looking for, what to look out for, contact to be careful about. And so, having said all of that, it doesn't look like at present the Ebola virus is any significant threat to us here in the United States. And we are doing the due diligence with people that are coming from the West African countries to make sure they have the education about if they're coming down with any symptoms whatsoever, they need to get checked out right away. If they were coming out with symptoms, you would go to your local hospital, and they're going to have low air pressure rooms that have an exhaust that sucks anything out that's in the air in those rooms. Those are rooms they usually refer to for a patient that has a contamination or an infection, contagious of some sort. Most hospitals are going to have such a room. And if you were to come down with such a thing, when you showed up at the emergency room, they would put a mask on you and they would take you to such a room, and then they would be very cautious. It's best to be cautious first and figure out you don't have it, then figure out you have it, and then say, oh boy, we messed up. So was that pretty clear?
Yes.
Okay. So again, the Ebola virus is one of many, many viruses. It's very contagious, and people do die from it for sure. To my knowledge, based on watching the news, we've got 2 people that contracted it in Western Africa, and they're now here in the United States being treated. And last I heard, they were both doing reasonably well.
Yes, improved.
Well, improving. Yeah. Let's use that statement. I remember hearing a statement came from one of the husbands. Came from the husband of the lady that contracted, because there's a husband and a man. The husband said he had already started making funeral arrangements.
Oh.
And so he was pretty elated because he's still overseas, I think, based on the newscast I heard.
Yes,
He had already started making funeral arrangements for his wife, and she's made a turnaround. So I'm sure he's pretty happy about that.
If a person should get the Ebola virus, if you are in good health, does that help in helping you to your body to overcome it?
Well, starting out in good health is going to help with any sickness or disease. So that's the underlying given. If children, little children, they don't have a lot of reserve, and older seniors, they don't have a lot of reserve. So this is why, when an older senior gets sick or a baby gets sick, they may go downhill very fast because they don't have a strong immune system. Your immune system is your police force. That's your white blood cells, and there are several places in your body they're made. There's some made in the spleen, some made in your bone marrow, and they're in all your lymph nodes, and they're sitting there waiting for a problem. And when you get an infection from some reason, you get a cut on your hand, somebody sneezes on you, you grab a doorknob that has some infection on it, well, that gets into your body. Well, immediately your body's immune system gets geared up to fight.
Okay.
And so they come from the lymph nodes, which are throughout your body there, your neck, your armpits, your groin, your elbow, under your chin, in your legs. Then you have, and so your white blood cells are in all those different areas. They're part of your immune system. So when you get an infection or get something that your body doesn't like, it sends the police force out, and it sends the police force to wherever the problem is, and it starts to beat it up and to take it over and to put it in check so that you don't get a more what we call systemic infection locally, like you got one place on your finger that has an issue, and then it spreads past your finger to the rest of your body. So that went from local to systemic. And this is why we treat many times to try to prevent something from becoming systemic. And when your immune system gets in there and begins to fight and to take over, if you've got a strong immune system, if you're healthy, if you've built it up, if you're exercising right, eating right, proper amount of water and sleep and all those things, those are the things that help boost and build your immune system, then you're going to be in a much better position to fight. If you're down and out and all sickly already and you have chronic diseases, diabetes, COPD, hypertension, you're not eating well, not sleeping well, overweight, not exercising, eat junk food, lots of it, all of those would be things that would break down your immune system. So if you gave the same infection to a strong, healthy person and to that same person I just described, in all probability, the strong, healthy person is going to do okay because their immune system will help fight it off, and the person that's not so healthy may not do as well. So that's kind of the way that the immune system works. So there are things you can do to boost your immune system. Garlic is a good thing that can help boost the immune system a little bit. I usually recommend a person take 3,000 to 5,000 milligrams a day of allium. Allium is the active ingredient in garlic. So when you get your garlic, you want to look on the bottle and get the one I use. I like Spring Valley gel caps. I usually don't really push any particular brand, but I like the Spring Valley gel caps because they're in a capsule. And if you don't swallow it on the first try, you won't taste it. They have an odorless component, so most times people won't know you're taking it, even if you're out sweating. And I like those, and they come in I think 1,200 milligrams of allium per tab, and so I usually recommend 3 to 5 of those per day to get the right amount of garlic to help boost your immune system. So garlic also helps with your blood pressure. It will help lower your blood pressure a little bit if you're having a challenge with your blood pressure. Taking garlic will help lower your blood pressure a little bit, not a great deal, but a little bit. But that's one of the things that will help boost your immune system, so that when you do come down with some type of infection for one reason or another, your body's more ready to defend against that problem. Some other common things that help boost your immune system? Well, we've already talked about sleeping just briefly. Sleeping 8.3 hours per night is the recommended amounts of sleep for an adult to live healthy. One should drink a quart to a half a gallon of water a day based on your weight. And the way I usually figure that out is you should drink an ounce of water per day per kilogram of your body weight. So, for example, if you weigh, say you weigh 150 pounds, and kilograms to pounds is about half. There's a factor of 2.2, but roughly we could just divide it in half. So if you weigh 150, half of that would be 75, and that would be like 150 pounds to 75 kilograms. And you need to take in the amount of water that you weigh in kilograms per day in ounces. So if you got 75 kilograms, that would be 75 ounces. Well, half a gallon is 64 ounces. And that's the amount I would suggest you should take on a daily basis to sit on the couch and watch television. Now, if you're out sweating and doing more, then you're obviously going to need more. And that can vary if you have problems with your heart, problems with your kidneys, other issues. Talk to your healthcare provider first. That's generally what I recommend before you do most of the things I'm suggesting to you, although they are safe. You do want to get some additional input from your healthcare provider in that. So that's the water. So water is very, very important, helping boost your immune system. Sleep. We talk about sleep. We talk about water. And what about your food? Your food also very, very important to help boost your immune system. You need to eat good food. And when I say good food, I'm saying trying to get away from the sweets and trying to get away from the fats. And we talked about the Mediterranean diet many times in the past. And if you think about the Mediterranean diet, it's a pyramid. Look at the top. The top is sweets and red meat 2 or 3 times a month. Beneath there you got poultry and eggs. Eggs 3 or 4 times a week, and the poultry. Beneath there you have fish maybe 5 to 7 times a week. Baked, broiled, steamed, or grilled, usually not fried. The middle of the pyramid you have olive oil. Extra virgin olive oil is going to be the type I recommend. Beneath that you're going to have fruits and vegetables. And at the bottom of the pyramid you're going to have grains. And so those are the types of things that I feel will help boost your immune system because they're healthy eating. Now, if you want to get more on that, go by my website, which is askdrferguson.com. Click on Frequently Asked Questions, and then you'll see the Mediterranean diet. Click on that, and that will have a little more details about that outline that I just described. So now we've talked about proper sleep, proper water, proper eating. All of those 3 are very important components of having a healthy immune system. And now we've been talking about the last several weeks about vitamins and minerals. And hopefully many of you have tuned in to some of those lectures and heard some of those as well. Well, what do the vitamins and minerals do? They help, many of them are antioxidants. Well, antioxidants, what does it do? It comes into your body and it fights against a free radical. Well, what's a free radical? A free radical is one of the cells in your body that's functioning abnormally, oftentimes because it's gotten exposed to some type of infection. And that normal good cell loses an electron. Around each cell, it's kind of like our Earth and the sun. Say you had 2 suns around our Earth. So, one of those suns goes away. Well, the Earth is not going to function the same if it lost one of those suns. And that's the way it is when your cells in your body, they have electrons around them. And if it loses one of those electrons, it's no longer going to function as well. And so what the antioxidants do is they come in and give that cell an electron back. Now that cell is back to its normal capacity and can function in its normal way. So that's kind of the way that works. And the Mediterranean diet is loaded with antioxidants. Many of the foods in the Mediterranean diet will be in the category of an antioxidant. So we've got sleeping is important. We talk about 8.3 hours. Then we talk about water. Roughly half a gallon a day for somebody who weighs 150 pounds, provided they don't have other medical problems. We talk about the Mediterranean diet, again made up of lots of different ingredients, but some of the underlying factors of the Mediterranean diet is many of the foods are strong antioxidants. So those are 3 things that are going to help boost the immune system. We talked about garlic. That helps boost the immune system. Let's mention exercise. Again, we're talking about things that help boost the immune system, and this came as a springboard question because she asked, well, will a healthy person be less likely, more likely to get the Ebola virus or any other virus? And that's how we started talking about the immune system today. So when you talk about exercise, what kind of exercise should you do? Well, that's a good question. But you want the exercise to do your heart some good.
Okay.
And if it does your heart some good, it means it's going to do your blood pressure some good. If it does your blood pressure some good, it's also going to do your kidneys some good. If it does your kidneys some good, it's also going to do your circulation some good. If it does your circulation some good, it's also going to do your tissue some good. So you want to do something that's aerobic, and you want to do something where it gets your heart rate up and keeps it up for 20 minutes, at least 3 to 5 times per week. So if you're busy around the house, you're cleaning, you're outside cutting the grass, you're doing this, and you're stopping, you're starting, I do not call that exercise. I call that work. Okay, so now I call exercise something that's going to get your heart rate up and keep it up for 20 minutes. So that means you need to be doing something that's continuous and consistent. Whether it's stepping, rowing machine, jazzercise, dancercise, walking around the block, running around the block, elliptical machine, walking machine, all of those things can get you 20 minutes of a continuous activity where you get your heart rate up. And that's important for you to get your heart rate up for 20 minutes because that's what's going to do your heart and your blood pressure some good. Now, you could pump iron with your hands and lift weights and things like that. That's going to do those particular muscle groups some good that you're working on. But it's not going to do your whole system the same that aerobic exercise is going to do.
So riding a bike and walking, they're very good.
That's good. Again, you want to be able to do something that's going to get your heart rate up and keep it up for 20 minutes. Now, how do you figure out your heart rate? Take 220 and subtract your age, and that's your maximum heart rate. And then take 80% of that, which is what you want to work towards. So, for example, if you say you're 50 years old, so subtract 50 from 220. What's that give us? That gives us 170. That's your maximum heart rate. And then you multiply that 170 times 80% to get the heart rate you want to aim for. So you want to aim for somewhere 145 to 155 for that maximum heart rate of 170. And you want to maintain that heart rate for 20 minutes. Now that's going to do your body some good. You want to do that 3 to 5 times per week. Whatever you like to do to get to that point. And don't start an exercise regimen and try to do that on the first day. You got to work up to that. Talk to your healthcare provider. Go to places like your local health gym or your local place where they have exercise equipment, and talk to somebody that knows what they're doing, and ask them to help put you on a program. Let them assess you first. What's your exercise tolerance? What are you capable of doing? And then have them help between the two of you put together a system that's going to work for you. Because the key is something that's going to work. So don't get an exercise regimen, something you hate to do. You're already defeating yourself. It takes 21 days, 21 Monday, Wednesday, Fridays, 21 weeks, 21 is kind of like the magic number. Some people say 28, but I think more people say 21. It takes that many days to develop a habit. So you need to be doing whatever that exercise regimen is, whatever that routine is, for 21 days, whether it's 21 Monday, Wednesday, Fridays, 21 weeks in a row, 21 days in a row, however you get to that 21. Now, what's important about the 21? What's important about the 21 is that now you've developed a habit. So when you develop a habit, you're much more likely to do it than before you develop the habit. So very, very important. So let's summarize again. So we're talking about boosting the immune system. There's lots of things we can do to boost the immune system. First one, I talked about sleeping, 8.3 hours per night. Then we talked about water, half a gallon a day for a person that weighs 150, provided you don't have other health problems. Then we talked about diet. We talked about the Mediterranean diet, using that as a guide. Talked about using garlic. I like the active ingredient in garlic is allium. I like 3,000 to 5,000 milligrams of that a day. Now we just talked about exercise, helping to boost the immune system. So these are some things that healthy living will bring you to. Now another product that's very good at boosting the immune system is called the Findol. The Findol you can find on my website. It's a product made by Unicity. So if you go to my website, AskDrFerguson.com, click on homeopathic, and or just if you just type in Defendol or click on homeopathic somewhere on the site, you'll come to Defendol. Defendol is a homeopathic product, and what it does is help boost the immune system. So I use that a lot with people that have allergies, because I use it a lot with people that have asthma. I use it with people that are frequently getting sick and illnesses and things like that, because it helps boost the immune system. Your immune system is constantly changing. Your cells, your red cells, your white cells, they're on about a 3-month cycle. So every 2.5 to 3 months, some of those cells are dying off, and your body's producing a new set. And if you can produce that new set in the midst of something like difendol, which helps change the environment of your body, then you may get rid of some things like allergies. I've used it for over 10 years now for patients with allergies, and with great success. I've personally used it with great success. I used to take allergy shots and go through boxes of Kleenex this time of year. I hardly do any of that anymore because I use the difendol regularly for over 10 years. But again, it helps boost the immune system, and now when my cells develop, they're developing in a new environment, which may not have what you were allergic to before. Other things that can help allergies, if you get some honey from your area. You need to get it from the area in which you live. Don't get it from way out of the place. But find somebody that raises bees in your area and get their honey and start using their honey for your sugar. So whatever you're going to try to sweeten something in your cereal, your tea, whatever you're going to put sugar on, use that honey.
Oh, okay.
And that can help in boosting of that immune system as well. You can also take a spoonful of it, but you got to be careful. You have diabetes, because that's a big sugar load. But honey definitely has been known and shown to help change your histamine, your environment, so that when you're having problems with allergies, you may no longer have those. So those are some brief things we can do to boost the immune system. People to know they can call my office at 252-332-6484. We're always happy to see new patients. Go by my website, which I've mentioned a few times, AskDrFerguson.com. If you go to youtube.com/user/AskDrFerguson, have a lot of videos on Alzheimer's disease, substance abuse with using Suboxone, have hormone balancing, have what's called the Passion Cam. On the Passion Cam, I put the camera on my dashboard and I just talk to the camera while I'm driving.
Oh, okay.
And that will be something positive. It's never going to be anything negative. It's going to be something positive and uplifting. So those are places that you can go to the internet and find some additional information, some additional things that may be helpful to you. And as always, you can come by the office. We're happy to see you. We really enjoy dealing in Alzheimer's disease. We enjoy dealing in hormone balancing. And we enjoy family practice in general. But those are a couple of things I really enjoy kind of diving into. And then as a side note, just as we're closing today, hormone balancing is probably one of the most successful areas of my entire practice. When we get the hormones in balance, we're able to eliminate so many symptoms: night sweats, hot flashes, irritability, painful periods. All these things that women have so often taken for granted that they're just normal. Those aren't normal things, and they can be treated. So on that note, to you locally and to all of you that have joined us on the World Wide Web, thanks for coming. Tell your friends about us. Come back and join us next week, and we'll have another exciting topic for you.
All right, thank you so much. As always, your talk shows are very informative. Thank you again.
All right, you be blessed and have a wonderful day. Bye-bye. And for those on the World Wide Web, tell your friends about us. Tell them, you can always come back and listen to these broadcasts because they're recorded, so you can come back to the website and listen to them at a later date. So come back, check them out, and tell your friends about us. Our goal is to provide you with some information that you can use instantly, right away, in helping to further your healthy living. So, on that note, to all of you out there on the World Wide Web, I want you to be blessed and have a wonderful day. Bye-bye now.